Hello, my name is Teresa Kachinos, and today I'll be introducing you to my research proposal on the effects of magnesium on metabolic syndrome. Before we review this study, I'm going to quickly review magnesium, metabolic syndrome, and its components. Magnesium is a very important mineral. It is the sixth most abundant mineral in the human body, although it is the second most abundant intercellular ion. Magnesium plays a vital role in metabolic processes such as glycolysis, oxidative decarboxylation, DNA synthesis, degradation, and replication, as well as RNA transcription. Magnesium is a building block to over 300 enzymes, including all of the enzymes associated with ATP use and production. Magnesium can be readily found in soybeans, kidney and lima beans, bananas, blackberries, broccoli, Brussels sprouts, carrots, cauliflower, corn, dates, and many others. Magnesium is primarily found in fruits and vegetables, as it is a building block in every chlorophyll molecule. Metabolic syndrome affects about 100 million American adults. It is defined as the combination of at least three conditions: hyperglycemia, hypertension, dyslipidemia, and/or abdominal obesity. A diagnosis of metabolic syndrome increases an individual's likelihood of coronary artery disease, stroke, sleep apnea, some cancers, testosterone deficiency, oxidative stress, and chronic obstructive pulmonary disease. Hyperglycemia, or type 2 diabetes mellitus, is a chronic cellular insulin resistance which creates high blood glucose. Left untreated, this can cause permanent damage to the eyes, kidneys, nerves, or heart. Diabetes affects about 29.1 million Americans. A diagnosis of hyperglycemia can be made with a fasting blood glucose of 100 milligrams per deciliter. Hypertension affects 75 million Americans, with only 50% having their blood pressure in control. Hypertension is attributed to 1,000 U.S. deaths a day, as it increases the risk of cardiovascular disease and subsequent complications. A diagnosis of hypertension is made with a blood pressure at or above 130/80 millimeters of mercury. Dyslipidemia is a combination of poor cholesterol levels. 73.5 million Americans have high LDL, with 31 million Americans having a high total cholesterol. Less than one-half of Americans with high cholesterol receive treatment to lower their levels. A diagnosis of dyslipidemia is made with triglycerides at or greater than 150 milligrams per deciliter, and with HDL being less than 40 milligrams per deciliter in men and less than 50 milligrams per deciliter in women. Abdominal obesity is defined as a high waist-to-hip ratio. In general, obesity is considered to be metabolically unhealthy. Abdominal obesity is associated with an increased risk of type 2 diabetes, stroke, infertility, and some cancers. A diagnosis of abdominal obesity is made with a waist circumference greater than or equal to 40 inches in men and greater than or equal to 35 inches in women. A comprehensive literature review of studies examining magnesium and dietary habits in adults with metabolic syndromes or the qualifying conditions concluded a few summarizing statements. Obese individuals in general do not consume the RDA or EAR of magnesium. Some, however, are able to maintain normal serum magnesium. However, these individuals tend to have a decreased urinary magnesium output. Only 10% of Americans consume the daily value of fruits and vegetables, with only 3% of Americans qualifying without fruit and vegetable juice. Remember, fruit and vegetables are the major dietary source of magnesium, as it is central to the chlorophyll molecule. Detecting and treating low magnesium in individuals with type 2 diabetes is considered to be appropriate. Oxidative stress is strongly linked to the conditions that make up metabolic syndrome. This is significant as magnesium acts as an antioxidant which decreases oxidative stress on the body. We're now going to get into the nitty-gritty of the proposed study. This study will aim to enroll 130 participants recruited by distributing leaflets to primary health centers with information about the study. Participants may be male or female and must be between the ages of 19 and 50 with enough symptomology to diagnose metabolic syndrome. Individuals under 19 and over 50 years, individuals who have supplemented magnesium in the last 30 days, Individuals who have hypo or hyperthyroid and individuals with cancer will be excluded from this study. Informed consent will be obtained. Participants who qualify will be enrolled. Baseline information will be gathered. Blood will be drawn and tested for serum magnesium, HDL, LDL, and total cholesterol. Urinalysis will also be done. A physical exam for height, weight, abdominal circumference, hip circumference, and blood pressure will be taken. Medications will be recorded. A 24-hour recall will also be completed by a trained technician. Participants will then be randomly divided into one of two groups, control placebo and magnesium supplementation. Individuals will not be made aware of the test group that they have been placed in. Participants in the control group will be provided a placebo magnesium supplement. These placebo supplements will be starch-based. Participants enrolled in the magnesium supplementation group will receive a supplement that matches the USDA's RDA for magnesium intake for these individuals' appropriate age and gender. Males 19 to 30 years old will receive 400 milligrams daily. Women 19 to 30 years old will receive 310 milligrams daily. Males 31 to 50 years old will receive 400 milligrams daily. Women 31 to 50 years old will receive 320 milligrams daily. All supplements will be provided to participants to ensure accurate dosage. Participants will return at 4, 12, and 24 weeks post-baseline. Researchers will gather blood tests to test for serum magnesium, HDL, LDL, and total cholesterol, as well as perform a urinalysis. A physical exam will also be performed to determine height, weight, abdominal circumference, hip circumference, and blood pressure. Participants will also do a 24-hour diet recall with the same trained technician. Upon introduction into the study, participants will be fully informed of the study and what will be happening during the duration of the study. Researchers will, as before mentioned, obtain signed informed consent from the participants. Data on participants will be recorded into a secure, password-protected database. This information will only be available to members of the research team. Identity will be attached to the data from baseline to the participant's completion of the study at 24 weeks. At the end of this time period, any identifiable information will be removed and the case will be given a random identification number. The use of identifying information while data is being collected is important in verifying the identity of each participant. At no time during this study should a patient come into harm for any foreseeable reasons. All supplementation of magnesium is within the USDA's RDA and should cause no physical harm to the patient. The results from this study will be quantitatively tested for statistical significance. Identifying information will not be reported, and data will be aggregated based on relevance to metabolic syndrome symptomology when appropriate. The factors of metabolic syndrome will be broken across the time period to see if improvements were seen across the 6-month test period. The information from this study may assist a professional in deciding whether it is appropriate to use magnesium in the treatment of metabolic syndrome. This study could lead to future studies on dietary magnesium versus magnesium supplementation, or magnesium in the treatment of the diseases that make up metabolic syndrome.